Well, hi, this is Robert, and welcome to the second episode of Outbreak News Across the Globe, a series I'm going to try to do on a weekly basis, taking a look at a big story concerning infectious diseases from 6 of the 7 continents every week. Of course, I'll be leaving out Antarctica. And I do it in an alphabetical order, so it's always going to start out with Africa. And this is Africa, you would expect me to be talking about all the big news concerning Ebola this past week. However, I did do a video last night on the grim milestone of the Ebola outbreak in DRC. And I'll link to that down in the show notes below, so you can check that out also. So I'm not going to cover Ebola this week, but I'm going to look at something that's really, really big, and that's measles in the Democratic Republic of the Congo. And this is from the World Health Organization's Regional Office for Africa. And it says Measles Control in the DRC. This is computer translated, so the syntax may not be perfect, but they're really trying to accelerate the mobilization of resources to stop this epidemic. And when I say epidemic, not joking at all. And it says, the acting representative of the World Health Organization and deputy humanitarian coordinator in the DRC gathered today, this was, I think, Wednesday, in the World Health Organization conference room with various partners to look at a broad mobilization to accelerate the fight against measles in the DRC. An epidemic that affects all 26 provinces of the country since the beginning of 2019. And get this, more than 161,397 suspected cases, including 3,117 fatalities. That's about 1,000 fatalities more than the Ebola outbreak that started in August of 2018. And that, of course, just hit the 2,000 mark. These cases were observed in 179 health zones in confirmed epidemics in the 519 health zones of the DRC. So about more than a third of the health zones have confirmed epidemics themselves. And here's the big problem, right? The reason for this is that vaccination coverage is too low. It's about 57% from 2017 to 2018. They don't have a second dose of the MMR vaccine. They only give the first dose. And they just have this large number of susceptible children. And this outbreak is it's like no other outbreak on the planet concerning measles as we speak today. So to put it all in a nutshell, they're trying to get things together, get more vaccination coverage, and fill in the financial gap to take care of a lot of this public health work that needs to be done. And this is a huge problem. It was actually declared an epidemic in June. So it went on for about 6 months before it was actually declared an epidemic. So it's a big public health emergency. And DRC is not short on public health emergencies, right? They got Ebola, measles, monkeypox, malaria. Pick your poison. They have everything. They have the most circulating vaccine-derived polio cases in the world too. So lots of problems in the DRC. Okay, let's go ahead and switch gears over to Asia. And I chose this story out of Pakistan. And Naegleria fowleri, right? The brain-eating amoeba. This amoeba that's found in warm, fresh water. Well, Pakistan frequently has quite a few fatalities on an annual basis. And according to this report from the Express Tribune, Naegleria claimed the life of a 12th victim in this current year. So 12 fatalities. And this is out of Karachi. So 12 fatalities out of Karachi, a major city in Pakistan. According to health officials, the rise in the incidence of deaths caused by the waterborne disease is attributed to the increase in the city's temperature and an inadequate amount of chlorine being added to the water being supplied to homes. So the latest fatality was a 16-year-old boy from one of the suburbs of Karachi. He was admitted to a private hospital, and 3 days later he did perish from the brain-eating amoeba. Now, this Dr. Imran Shah, he's quite vocal about the situation that's going on in Pakistan. He said that the provincial government has completely failed in ensuring the public health and saving citizens from preventable diseases. And Karachi's going through, in Pakistan, are going through several other issues, right? They have Crimean Congo hemorrhagic fever going on. They have a dengue outbreak, a large HIV outbreak, particularly among young children. I think they're battling some rabies issues right now. So they have a lot of issues going on at the same time also. And of course, when you talk about Pakistan, they are reporting large amounts, let me put it in perspective, compared to recent years, large amounts of wild polio virus this year also. So a lot of problems there. Dr. Shah goes on to say, the chief minister has loaded his cabinet with an army of incompetent persons who are only busy in embezzling public money. Harsh words from Dr. Shah, right? He demanded of the provincial health department to impose a health emergency in the city and take effective measures to curb the spread of all contagious diseases. Quote, this government has become an enemy of the people. He pulls no punches. Adding that it would be better if the chief minister and his cabinet resigned from their offices if they were not capable of ensuring the safety and life and property of citizens. So, yeah, Karachi has at least one very harsh critic. So, yeah, and this is something we follow every year on the website outbreaknewstoday.com. And we see a half a dozen or more cases of Naegleria fowleri every year. They usually do not say how the patient contracted it. Here in the United States, most of the time it's through recreational water, lakes, rivers, recreational fresh water, the water rushing up your nose. But I suspect most of these cases out of Pakistan are from nasal rinsing, which is a thing the Islamic religion does as part of their faith. And if the tap water there is not being properly chlorinated, they're at high risk, obviously. Okay, next on the list is Australia. So Australia would be some of the Pacific Islands, Oceania, right? New Zealand, which we covered last week with the measles outbreak, and of course Australia proper itself. And what I want to talk about today is this interesting study from Flinders University in Australia. And it's about a nematode parasite called Strongyloides. And it says, a human infective nematode found in remote northern areas of Australia has been identified in canine carriers for the first time. Flinders University environmental health researchers with experts in the USA have found a form of the soil-borne Strongyloides worm in feces collected from dogs. Strongyloidiasis, carried by several kinds of Strongyloides species, is estimated to infect up to 370 million people around the world, mainly in places with poor sanitation in developing or disadvantaged communities. And it's a pretty serious parasitic pathogen. The infection in the gut remains hidden, but can cause abdominal pain, diarrhea, and bloating. Some people may experience nausea, vomiting, weight loss, weakness, constipation. In chronic infections, skin and chest symptoms can persist. And in certain types of cases, they could have hyperinfection, autoinfection, so it can be very severe for somebody who's immunocompromised. Well, the Australian study involving 273 dog feces samples compared to 4 human samples were screened using real-time PCR. of which 47 dogs and 4 human DNA samples were then amplified by conventional PCR with further sequencing. The complete set of amplified sequence variants was also analyzed. Quote, ultimately, we were able to confirm for the first time that potentially zoonotic Strongyloides stercoralis populations are present in Australia, and suggest that dogs might represent a potential reservoir of human strongyloidiasis in remote Australian communities. This is according to Flinders researcher Dr. Mira Beknazarova. I hope I said that right. Our study was able to independently support previous reports of at least 2 genetically distinct groups of Strongyloides stercoralis, one infecting both dogs and humans, and another group that is specific to dogs, she said. So, yeah, very interesting study. And as the researchers say, this is the first time it's been found in canine carriers. So, very interesting news out of Flinders University. Okay, let's go over to Europe. And some saddening news, right? Because we've seen a lot of measles activity in Europe in the past 2 or 3 years. And the World Health Organization's Regional Office for Europe reported Thursday that following several years of steady progress toward the elimination of measles in the WHO European region, the number of countries having achieved or sustained elimination of the disease has declined. This was the conclusion of the European Regional Verification Commission for Measles and Rubella Elimination, based on an assessment of annual status updates for 2018 submitted by the 53 member states of the region. So this commission, call it the RVC, determined that for the first time since the verification process began in the region in 2012, 4 countries lost their measles elimination status. Now, about a week ago, I reported on the website that the United Kingdom lost it, but they're not alone. We also see now that Albania, the Czech Republic, and Greece, all 4 of those countries, lost their measles elimination status. Now, reestablishment of measles transmission is concerning. If high immunization coverage is not achieved and sustained in every community, both children and adults will suffer unnecessarily and some will tragically die. This is according to the chair of the RVC. But, all right, we have a little bit of good news here. The RVC did say, on the other hand, that they concluded that Austria and Switzerland attained elimination status. And elimination status translates to the demonstration of interruption of endemic transmission for at least 36 months. So, but all in all, not good news for Europe. They have been struggling with measles over the past several years. And for these 4 countries, they lost their elimination status. And I did see some reports concerning speculation in the United States that the U.S. is kind of teetering toward this possibly happening to us also. So, well, we'll see what happens. But we've got to get vaccinated, get people vaccinated. Okay, let's go over to North America. And I had a lot of choices for this week, but I wanted to talk about this one because the CDC put out an update on Thursday about the situation with domestically acquired cases of Cyclospora. And it is a year-round issue in the United States, but we're seeing a lot more in the spring and the summer. There's obvious reasons for that. But what we're seeing here is the number of reported cases of domestically acquired cyclosporiasis has increased from the previous month and remains elevated in the U.S. since May of this year. So I think it was July 23rd was the last update, and there was 580 cases of laboratory confirmed domestically acquired cyclospora infections. So a month goes by, Now it's 1,696 cases from 33 states, DC, and New York City. These are people that had no history of international travel during the 14-day period before illness onset. So more than about 1,100 cases in the past month. Now some of these are associated with different clusters and restaurants. And of course there's the one larger outbreak that's going on that's linked to the fresh basil imported from Siga Logistics in Mexico. And I think the latest report, well, I might have that next. Yeah, here we go. So I haven't had an update on that in 2 weeks. However, as of August 15th, there was 205 laboratory confirmed cases in 11 states. So that's still just a small portion of the overall Cyclospora situation in the U.S. So that's my coverage of my story choice for North America. And lastly, South America. And this is an older report, but I need to use this to preface what's going on in Venezuela, because there's a mass exodus going down there for a lot of reasons. Political chaos, food shortages, water shortages, electricity being turned off all the time, and a hyperinflation where they're predicting it's going to be up to 10 million%. 10 million%. I just can't believe it. So the UN has called this exodus the largest in the recent history of Latin America and the Caribbean. So basically, there's been about 4 million people that have left Venezuela since this crisis has began. A large number of people. And a good portion of the people that have left are going to the neighboring country of Colombia, which has brought in about 1.34 million Venezuelans to date. And then there's Peru and some of the other neighbors that have brought in, hundreds of thousands of Venezuelans. So that kind of leads me to this computer translated story from the Ministry of Health in Colombia. And about a week ago, they had a conference. Some of the health ministers in the region trying to get together and analyze the Venezuelan migration phenomena and formulate some strategies to take care of this, because you got a lot of people leaving that have a lot of issues, whether it be food or in particular health, and that's really what we're focusing on here. The ministers will begin the workday by exploring the level of care and proximity of Venezuela, the volume of patients that they're getting from this country. They toured different hospitals and emergency rooms to learn about Colombia's public health care response to this migratory phenomena. Really big issue. And of course, sticking to the theme of this show, this meeting, in addition, will serve to present the proposal for a unified vaccination card for migrants, and actions will be defined on issues such as HIV, malaria, mental health, among others, as well as strategies to encourage international cooperation. Yeah, so a lot of these people from Venezuela are plagued with different diseases. It could be malaria. There's measles outbreaks going on there, diphtheria, a number of other infectious agents. And that leads me to the final part of the show. And this was actually a OutbreakNewsToday.com exclusive, talking about the malaria epidemic in Venezuela. And I had the opportunity to talk to Leopoldo Villegas. He's a Venezuelan physician that's here in the United States, and he's involved with some organizations that are working on the ground trying to figure out the true tally of malaria in Venezuela. And he sent me these different charts, and it says malaria in Venezuela So between 2000 and 2018, we've seen a 1,262% increase in cases. And that's the number from the Venezuelan Ministry of Health. Now, according to civil society, this is this group of healthcare organizations, they say the Ministry of Health is low. And in fact, it's more like 2,373% increase in malaria between those 18 years. So nearly double. And the big thing that Dr. Villegas had to tell me was the increase in malaria is forecasted. They predicted, or they said there was about 1.3 million cases, 1.3 million cases of malaria in Venezuela in 2018. I mean, just astronomical. It's numbers that you just don't think you would see in the Western Hemisphere. But they are forecasting that in 2020, the number of malaria cases will be 2.5 million. 2.5 million. And down here you can see some of the organizations that are involved in this work. And Dr. Villegas told me that they have a lot of people on the ground. They're doing forensic epidemiology, doing a lot of different work like that to get the true numbers that they think that the World Health Organization and the Venezuelan Ministry of Health are totally lowballing this. Anyway, so yeah, so that's my story from South America, and that is the second episode of Outbreak News Across the Globe. And I hope you enjoyed it. Go ahead and comment below, share it with your friends, subscribe to the channel, and I'll see you next week.